Breathing in, there is awareness of breathing in. Breathing out, there is awareness of breathing out. Breathing in, breathing out. In, out. Where do we suffer? The physical body and psychological mind. Mood disorders. Part 2. Disruptive mood dysregulation disorder, or DMDD. In response to certain children and adolescents expressing intense irritability, seething anger, and explosive tempers without the manic features of bipolar disorder, disruptive mood dysregulation disorder describes a condition that requires at least 1 year of daily occurrence, as well as must be present or observed in more than one environ. For example, more than just in the child's family or home, but also with friends or peers, and while at school. Seasonal affective disorder, or SAD. Seasonal affective disorder describes how one's mood may wildly fluctuate from season to season, or, as is often the case, becomes affected during just one season. Typically, it is the darker, cloudier, and colder months that the experiencer becomes despondent or depressed, because too little serotonin is produced, the hormone that is somewhat responsible for one's ability to feel good, and yet some of us become anxious, restless, and even agitated during the brighter, sunnier, or warmer months due to an underproduction of melatonin, which causes us to be more alert and less sleepy at night. Checking the inner and outer weather. Cloudy days, rain or snow, fog, and particularly frigid temperatures can individually and even collectively cause any one of us to feel some degree of sadness or depression, just as perpetual days of sunshine, aridness, and hot temperatures, largely due to one's inability to achieve and maintain comfort in keeping warm or cool. The stress prolonged or extreme weather can place on the body and mind that could further and adversely affect one's cognitive abilities, attitude, mood, and, ultimately, behavior. It's that time of year again. Far from seasonal changes and how they affect the body's various hormonal processes becomes the sole reason why perhaps any of us are moody or otherwise depressed at any point in the year. Oh no. In some cases, certain childhood experiences that caused us intense pain and even trauma may have occurred during or throughout one or more seasons that still adversely affects us whenever the same time of year rolls around. Again and again, year after year.